Welcome to All Things Chiropractic.
Welcome to another episode of All Things Chiropractic. I'm Paul Andrews.
Welcome, everybody. Dr. Mark Davini.
And this is advice I could use for myself, but today's episode is on stop slouching.
As he was sitting there straightening up in his chair.
Yeah, right.
Yeah.
Yeah, exactly. I do slouch too much, but that's another story. So what we're talking about here is, we're going to look at the benefits both from clinically and business-wise about posture analysis and chiropractic. We talk about this in our CAP course, which prepares the CAs for the national exam. We actually teach them posture analysis, don't we?
Yeah. Chiropractic Assistance Procedures Program.
And you tell me, like, in school, chiropractic school, how much time do they spend educating on posture analysis?
Well, we had a fairly extensive amount of education on it because if you think about what posture is, it's really a reflection of your spine underneath all the skin and muscle.
Doesn't an x-ray do that, though?
An x-ray can do that also, but there are people who don't have x-rays in their office. And if you don't do posture, what other way, outward way, visual way would you have to demonstrate change in a patient's conditions or structure?
So it kind of leads back to that educating the patient and personalize it, right? Because having a full-length mirror in your office would probably be helpful so they can see what you're coming up with from an analysis standpoint. Or, right? I mean, I don't know. You said you used to have mirrors in your office, right?
Right. And that was mostly to give them comfort about them feeling trust that I was never behind them and doing things that they didn't see. But when you look at posture, we might be able to look in a mirror and see how we look from a certain viewpoint, that one viewpoint. But we know chiropractically some of the more disturbing views of our posture are really from the side. So when we look at us with that, severe forward head carriage or slumping shoulders or, we're bent forward, whatever, we don't see that when we're looking straight on in a mirror. Dimensionally, we take this three-dimensional structure of a human being and we're reducing it to 2 dimensions, the mirror itself. So most of us look at it and go, oh, I'm pretty straight. And then all of a sudden, if you were to be examined for your posture and you find out that your head is entering the room about 3 minutes before you, and things like that is an issue.
Those posture posters that I've seen where it has like the whole range of from normal. I thought for me, so I'm like, hey doc, where am I? And the further down the line on the poster, the more I was disappointed. But then I was like, felt the need, right? I'm like, okay, well, fix me. Like, I don't want to be, because I'm looking all the way at the end going, is that my life? Is that where I'm headed?
And here's a motivation, if nothing else, about determining posture. Posture is the reflection of our spine reacting to gravity is the exact reason why chiropractors exist. Once we took our bodies and stood them upright on 2 feet and created this tremendous balancing act that has to take place just for us to exist in the upright posture, we created the need for a chiropractor. The mechanical model for the human body, if you look at it, the engineering model is 3 pyramids inverted upside down on each other. And then all the muscles, tendons, and ligaments have to keep those 3 pyramids balancing on each point in the upright posture.
So what do you think the posture looked like for those 2 astronauts that were stuck in space for like a year?
Well, I can tell you they were probably taller.
Yeah. Oh, wouldn't that be nice?
Wouldn't that be nice?
Let's go up in space for a while.
That's why I wanted to be an astronaut, But they were probably taller because their discs hydrated more without gravity compressing them on a day-to-day basis. We are taller in the morning than we are at the end of the day. So I did have one patient that wanted to be a state police, and he was like a half an inch too short for the
So he said coming in the morning?
So they rescheduled his exam for the morning, and he passed.
Rushed in?
He came in, got adjusted, and then went to the exam. There's a lot of different ways in which gravity can affect us, not to mention things like trauma and anomalies and things.
I'm curious because obviously their lean muscle mass reduces when you're in zero gravity, right? Because you don't have no resistance. So seeing some of the pictures when they came back and how sort of like frail they were in a sense.
Right. Very frail. They lose bone density.
Yeah.
The muscle, they do work on the muscle. They do exercise on a regular basis. But again, weight-bearing exercise is very different than just moving the muscle. So they had a certain amount of muscle strength, but they didn't have any postural stability.
Yeah.
Because and we know posture is a reflection of many things, but one of them that's necessary is our body's proprioception, our ability to know in space where each part is. And we constantly are adapting to the movement of the earth, which is at 1,000 miles per hour, right? We're constantly adapting to the movement of the earth through our proprioception. And posture is in part, a reflection of our body's ability or lack of ability to send signals to the brain. Look at a baby. They're born without proprioception. And when they start to maneuver, they're on all fours because they need the input awareness of all four limbs telling the brain where it is. As they get older, they stand up and they start walking, but how do they walk? They walk with a very wide stance and they waddle because they need that wider base to be able to balance. Their proprioception's getting better, but they need the wider base. And then as we get to adults, our feet come in. We walk with our feet together and there's a nice even stride because our proprioception's at the peak. Then we get older. What happens again?
Well, just seeing you walk in the door today, I know exactly what happens.
You get a little wider again, right? And then even because now you need that wider base. And then let's progress even more. Sometimes you need that extra assistance of input to your brain, a cane.
Back on tripod. Yeah.
So, and then from there, maybe a walker. And you're back to all fours again. So it's all about proprioceptive input sometimes to maintain posture. And then again, we have all those other issues like structure and things like that. So
when we look at posture in the practice, there's some really cool technology out there. We've seen a little bit at some of the conventions, like with these digital apps that are on your iPads or your tablets or whatever can do an awesome job of analyzing posture and spitting out a report.
Oh, I love them. And it's something your CA can do. It's actually really a high-tech version. Many years ago, I did a study for the Polaroid Corporation.
For those that don't know, that was an instant camera.
Yeah. They still have them, they're still around. But Polaroid developed a film that actually put a grid on the picture. And we were trying to determine if that grid was reliable enough to use for detailed posture analysis. Obviously, it worked well for gross posture analysis. So I conducted this study to analyze the reliability of that film and whether or not we can use it to measure changes in posture. Turned out that we couldn't because the film grid would move on the frame of the film itself.
Oh, it wasn't perfectly. Was it a bigger picture than the normal Polaroid?
No, and it was a small picture, so, a lot of times it would shift, but it was a good picture for gross posture, head, shoulder, tilt, and all those kinds of things. But fast forward to today, we have these phenomenal apps that measure your forward head carriage and then calculate how much more weight your head is putting on your muscles because it's hanging out there in front. Remember, we have all these perfect postures, 3 curves that are one on top of the other in this inverted pyramid engineering model that a lot of it has to be balance, not just contraction of the muscle. You want the muscles to adjust a little bit here and there to keep your posture where it is, not constantly be contracted like forward head carriage causes.
So how, as a doctor, how much would you know about that patient just visually analyzing their posture before you even talk to them?
And it certainly depends on your technique because there are techniques that are posture-driven, CBP and things like that, which are very great techniques also. Me personally, I use it as a gauge to what I wanted, what I thought was going on underneath because I always tried to, in my mind, visualize what was there before I actually even knew it because I would take x-ray also. And also was a nice gauge to see pre and post that you actually did affect a change structurally, even if it was temporary for that moment, and then maybe even a more permanent change as time went on, as you got that forward head carriage, you got their head back on their shoulders where it belongs.
But as a layperson, I'm in your office and you're telling me about this posture, and I'm saying to you, well, how exactly are you going to help my posture get better? Like what is the actual structural change that could be happening with chiropractic care?
Well, personally, for me, again, I would relate the posture to the X-ray. So you say, here's your subluxations. Here's what I think I can do. And obviously, you can see the mechanical compensation to those subluxations. And I'd explain to them a little bit of that process. But generally, it was always a relationship between this is where you are. This is why it's there as a chiropractor, subluxations. And this is where I hope it can be. And as you treat and as time goes on and you're able to do some pre and post and demonstrate that, sometimes as simple as that new app today, which could actually eliminate a lot of the need for post x-ray for at least monitoring change as their head goes from a very, strong forward head carriage to upright on your shoulders more and more and more. And patients appreciate that. They're seeing things, we talked about it. They don't see their side posture.
Make me want to,
I know he's squirming in his chair.
I have to just better posture in the chair.
So it's great patient management. It's great clinical feedback without even going so far as to take x-ray. So you avoid that radiation. It's great education for the patient and motivation for the patient.
So if an office that's listening to this podcast is saying, well, I don't take x-ray in my office for whatever reason, how important would posture analysis be in that clinic?
Critical in my mind, because what other way other than symptoms, and, you can have them bend and move and show them that their movements are improved, but I'm talking about an outward visual change. What other way other than x-ray could you demonstrate an outward visible change? Somebody sees you and says, boy, you look taller, you look straighter, you look this, you look that. Other than posture, what else do you have? Not to mention all the clinical benefits. Put that aside. Just as a pure marketing tool, what other way can you show a patient for all those visuals that are out there, which are most of us, 87% of the people out there are visuals. How do you show that they've improved through your care?
So what I'm hearing is that a patient's vanity plays a lot into their dedication to a treatment plan, perhaps?
Yeah, let's face it. The two big motivators are vanity and vice. When times are bad, people drink. When times are good, people drink. If you think about the fact that you could have one tooth replaced, between a root canal and an implant, you could spend upwards of $7,000-$8,000.
And a long
one tooth.
Time to do it, too.
And a lot of time and effort and discomfort, too. One tooth. So if you're trying to make patients understand why they got to get rid of that submarine thing I got in my spine that's behind me and I can't say it anyway, right? It has to be somehow relatable to them. And the most common way to relate things that motivate patients to do what you want them to do is either pain, symptoms, but when the pain's gone, what's left? And somewhere in there, you have to find what that is, and each patient can be a little different. But I can tell you the two most common motivators, vanity and vice.
And if you don't think that, just look at the rise of GLP-1s. I don't want to digress into those, but I can tell you that insurance companies are losing their shirt right now on prescriptions of that.
Oh.
And people like my neighbor, he's in his early 70s. He is still a very active guy. He still landscapes a little bit. He was a landscaper. So, he does more active stuff than I do. And he went to the doctor and he was 15 pounds overweight because it's winter. And they offered him the shot.
Oh my God.
We're talking 10 or 15 pounds. And he's like, no, thanks. I'll handle it. But this is, there's a lot of those prescriptions happening. And, and I dare say as much as there's a lot that are morbidly obese and they need something to happen to help reduce that mass, there's a lot that vanity really does play into it.
So again, not putting aside all the clinical and all of the importance of understanding the cause of posture, it's also a great marketing tool.
And just curious too, other than musculoskeletal, are there any health problems that posture could actually lead you to suspect?
Well, it is the whole foundation of chiropractic, right?
Yeah.
That when you have subluxations cause health issues. And putting aside any congenital anomalies, malformations, degenerative changes, posture is usually a reflection of some level of subluxation present, whether it be new or old. So from a chiropractic perspective, we are looking at certain postural deformations may result in an interference with the nervous system. And that's why they need to see a chiropractor. The sooner the better. It was great if you're in a school system where you help do posture screenings and screen for scoliosis and things like that, but for the most part, the sooner we see someone and correct those subluxations, the better. But a lot of times we get them when it's down the road, but that doesn't mean we can't help them.
It made me think of something. This is probably too general of a question, but I'm going to ask you anyway. Because I had a schoolmate through school, like middle school to high school, and she was stuck with a brace most of that time. And looking back on it now, I've seen so many times where the doctor I work for took them out of the brace and said, "Stop wearing that stupid thing." I mean, I guess it depends on the actual condition, but what are your thoughts on?
Right. I mean, the curvature of the spine, which is really what the condition is, because scoliosis is a radiological term that means lateral deviation of the spine from the midline. But basically, curvature of the spine conditions, technology has advanced tremendously, especially when it comes to bracing. There are what they have today called dynamic braces, where the brace is designed to put pressure in certain directions based on your inspiration and expiration. So it's not just statically holding your spine or trying to hold your spine in one place. It's actually dynamically moving the spine in directions it needs to go to try and reduce those curvatures. So I won't say that there's no such thing as a good brace. Back then, I might have said that, but not today. There's a lot of different options, some of which include these functional braces that really make a big difference. But chiropractic, again, chiropractic is one of the main elements necessary to maintain proper posture. If they do have this idiopathic scoliosis type of thing where we don't know why it happens, certainly there are other recourses like the functional models, but that doesn't eliminate functional braces, but that doesn't eliminate chiropractic from the formula. So yes and no. Old braces, oh my God, the old Milwaukee braces
Awful.
and things like that, as soon as they took them off, they generally just, depends on how long they wore it, but they generally just returned to where they were, if not worse, because they never addressed the reason. How many times as a chiropractor do we say, fix the cause, not the symptom?
I mean, that's the mainstay to me.
That's everything. And posture is a reflection of something most of the time, of course, always qualify that. But posture is generally a reflection of something out of balance. Your body has lost its homeostasis. Something is not the way it's supposed to be, or at least not functioning the way it's supposed to be. That's what we do.
So I'm going to probably reveal my clinical ignorance here because I'm not a chiropractor, but kinesiotaping, does that have any support on posture?
Anything that reminds a patient keeps them aware of their deficiencies of their posture, I think is a good thing. Certainly the kinesiotaping, to me personally, when I experience it, I feel that its number one benefit is an increased stimulation of proprioception.
Oh.
That's the number one. It pulls on the skin, it tugs on the skin, it decreases pain through the inhibition of your pain, your nociceptors through stimulation of the proprioception. So I think it's very valuable as a tool to make the patient more comfortable. Also as a tool to stimulate reminders or awareness of what it is you're hoping to do. And again, there's a difference between kinesiotaping, corrective taping, static taping, and all those things. By itself, no. But in addition to everything, it's another tool in the bag, another tool of practice. So to speak. So yes, I do like it. I think it's something that can be used readily and effectively.
So do you think that somebody's posture will improve more quickly if they're not just getting chiropractic adjustments, but they're also contributing to their own care with home exercise program or therapeutic exercise in the office? Does that, the supporting the musculature around those adapting and changing, posture?
Oh, absolutely. Because let's face it, as chiropractors, we can probably trace through x-ray and exam those deviations of posture that were the result of chronic subluxation. There's certain patterns and certain things about them. We also know that there's certain curvatures that result from congenital anomalies, wedge vertebrae, transitional segments of the sacrum, whatever. So we also know that sometimes it's not directly the result of some acquired subluxation in their life. So it's important to assess what is the cause of the curvature. And then there's also those curvatures that we just don't know why yet. Not a lot of research. And those are the ones you're talking about where all of a sudden the spine starts curving for no good reason. Muscles are contracted, other muscles are relaxed or whatever. So all tools in the bag are up for grabs, literally, when it comes to these things. Those that are subluxation-based curvatures, we are very effective in changing if we get them earlier, and very effective in changing at least symptomatically. But those that are happening, no matter what, for whatever reason, you have to change the structure. We change the structure through adjustments, rehab, kinesiotaping. Sometimes there may be lifts put in the shoe, orthotics in the feet. Everything is on the table, literally. Traction, forms of traction. Everything is on the table because as you get older, the spine responds to pressure on certain areas. So the more pressure on one side, that's where the body starts building up and reinforcing with more bone or more calcium deposits. That's where the spurs come from and the arthritis comes from. And so it's important to try and minimize the curvature as early as possible. And if it's already there and it's set in stone, more or less, literally, because everything's just sort of worn into that groove, then you have to deal with it from a management perspective.
So you could say that arresting the progression could certainly be a chiropractic, benefit clinically.
Right. Yeah. Earlier, possibly eliminate, but definitely the later on in life, managing it and slowing it.
And from a claims billing perspective, which I always, in my brain, if you can reinforce the need for that care, the patient's on board with the, not just the clinical need, but the need from a vanity standpoint, but also introduce a nice modality or a therapeutic procedure, let's say like therapeutic exercise, where they're engaged and they're helping arrest the progression and or improvement, well, your revenue goes up too.
Exactly. And you have an item that can be done by an assistant, usually, and they can use an app if they want, that is very effective in demonstrating the issue, educating the patient, motivating them to stay under care. I mean, where's the downside of this?
Well, I think one of the things you just said that resonates with a lot of docs is you can engage your chiropractic assistant clinically to assist in analyzing the posture, and you sort of just check the results. Now you've got somebody else in the office spending the yeoman's amount of time, and you're just checking the work. And there you go.
Yeah, you print out the report and just say, hey, look, your head was like in the next room, and now at least we have it in the same room. So
yes, right.
Yeah.
It's kind of like why, doctors that don't do vitals on their exams, your CA can do these vitals for you. Just check them. Like,
yeah, it's crazy. And totally aside, if you're not doing vitals in your practice, then you should. And I am telling you to do vitals. All 4 major reasons why a patient comes to a chiropractor have a vascular alternative. So just think of it that way.
There's a lot of food for thought there. That's probably another podcast
That's
in
another
itself.
podcast by itself. But
it is.
Throwing it out there.
It's a pretty good idea.
Yeah.
But beyond, because as a chiropractic assistant myself, as a CAP CA and a triple CA myself, doing posture analysis and teaching it when we do our CAP course, it's not hard. Really, but it's actually it's not fun when they do it on you because you're trying to have the most perfect posture and it just doesn't work structurally.
Oh, it doesn't want to put it that way,
but being able to just give your CA that responsibility. Again, it's like this career path for CAs too. But beyond that, again, it offloads that yeoman's amount of time because you want to see your patients, you want to adjust them, but it gives all of the things we talked about, the benefits, the educational benefits to the patient. To me, as a layperson, if I'm not seeing especially if I'm not seeing the x-rays of myself, it personalizes what you're telling me. Otherwise, it's just, you're telling me to get adjusted. I lay on the table, you do your magic, I get off. It's not very long. And Is this helping or not? I don't really know. Maybe I feel better, but if I'm moving towards wellness, how do I move towards wellness if I don't have wellness on my mind?
If I don't even know what wellness is, let alone how I can see whether or not I am becoming more well.
You might feel well,
right?
But
to see it.
People want to see. People want to see it.
87% of the people are visual. You want to see that you're standing straighter, looking taller. At least I do.
Yeah. Well, taller. Good luck.
Yeah.
Go out in space for a little while.
There we go. There we go. So,
all right. So, that being said, from a member's moment standpoint, do posture analysis, even if you do x-ray. Have your CA contribute to that.
Please.
We have our triple CA course online on demand that you can have your CAs, if you're members, of course. If you're not members, you can pay for it, but we have it available. It's not difficult. And it's just another tool, as you say, in the toolbox of things that are going to make you stand out from the colleague down the street too. You know what I mean?
I agree. I mean, there's no downside. There is no downside.
At all? You sure? To me,
There's only an upright side.
Ooh. Yeah. I would probably invest a small amount of money in one of those apps and have my CA do that with a tablet because
love them.
It spits out a nice report and you get to measure the progress. The metrics is pretty cool, I think.
I love it.
Of course, if there's a lack of progress, it lets you change your approach too, right?
And then we can talk about another podcast on change.
Right. I suppose if there's a lack of progress, Doc, wouldn't that tell you that there might be an alternative that you haven't considered that requires more investigation?
Exactly.
Right.
And sometimes the most difficult thing we can do is hold ourselves accountable. And posture and x-ray and, of course, the exam and the findings, they all hold us accountable to our performance as a chiropractor. And most of us, if not overwhelming majority of us, do a great job of changing our patients' health and well-being. But if for some reason we're not, like you said, self-examination is the most humbling thing sometimes.
What you're saying is posture your practice for success.
Yes.
Okay, on that note, before you cut off this podcast yourself, thank you for joining us for another episode of All Things Chiropractic. I'm Paul Andrews.
And Dr. Mark Davini. Thank you all.
Thanks for listening to All Things Chiropractic. We'd love to hear from you. Visit allthingschiropractic.com with comments, episode ideas, or questions. Or connect with us on Facebook and Instagram at All Things Chiropractic Podcast. Be sure to join Dr. Mark Davini and Paul Andrews next time for another episode of All Things Chiropractic.